Welcome back, everyone. I hope all of you found those breakout groups helpful and informative. I'd now like to welcome and introduce the patients for our gynecological cancer patient panel, Kimberly, Gloria, and Barbara. Thank you so much for joining us today and for sharing your stories with us. I'd like to start with each of you by taking a few minutes to briefly explain your cancer experience. And if you have any questions for our panelists, please submit in the chat box. You can also submit them to me individually to be anonymous. Thank you. And so if either Gloria or Barbara would like to start first.
Barbara, would you like to go ahead?
Makes no difference to me, whatever you like.
Okay, you may go ahead.
Okay, my name is Barb Schlatter. In September of 2019, I was diagnosed with stage 4 ovarian cancer. I have the background of being an outpatient oncology nurse. So I came into this with a unique point of view, I think. And my way of dealing with things was that knowledge was power. And the more I knew, the more options that I knew were available to me for not only the initial step, but going forward, just helped me immensely. So that's me in a nutshell and my plan of attack.
Good. Good morning. My name is Gloria Parker. And in May of 2020, I was diagnosed with endometrial cancer. And at first I had that oh no moment because I lost my mom in 2017 to uterine cancer. But then because of my faith, I think that's what really helped me so much. I began to realize that I was not my mom. And just because my mom passed with it didn't mean that I have to pass with it. After all, she was 90 years old and her body was in a different shape and just a lot of things going on. But then too, I looked at the fact that if I went into this, I figured with a positive attitude that I would have a positive result at the end of it. And that's exactly what happened. I looked at the wonderful medical team that was provided for me, the doctors, the nurses, and then my family and all of the caregivers, everybody that came alongside me. So I just went into it with the attitude that at the end of this great big process that was going to take place, this treatment process, I made sure that I didn't look at it as the individual steps, but I just tried to look all the way to the end of the process to see that these individual steps that I was going to take was going to help me to reach my goal of being cancer-free at the end of it. And I'm so grateful to say that because of the doctors, because of the care, and because of my faith, that's exactly what happened. So I am now cancer-free, and I'm grateful for that.
Thank you. I have a question just to get things rolling and a little bit of a discussion for you two. Is there anything that you learned later on throughout your cancer experience that you wish you knew earlier on that would have been beneficial?
The one thing that was kind of my aha moment was that everyone wants to help in some way. As a very independent woman, my asking or accepting help was pretty much not part of my vocabulary. But I found that if things were phrased in a way that if someone were to say, I have so much time on any given day, what can I do for you? You know, shopping, visiting, going out for lunch, just anything, knowing that they had set aside that dedicated amount of time and were truly available, that it wasn't just a blanket, oh, let me know what I could do to help. I think that's valuable for patients and caregivers to be able to share that with those you know.
And for me, one of the big things, because I've always been a very active individual and just kind of like you, Barb, very independent. One thing I learned as I went through the process, even into the process, I had to get more rest. I had to give myself time to rest. I was always active and I just pushed myself and pushed myself. But I learned, and I thank God for the doctor I had that said, when you're tired, get the rest. My daughter had to teach me how to take naps. I just wasn't used to doing that. And the
Right.
chemo and the radiation does give you fatigue. And sometimes I was trying to push over it. So I was kind of fighting against myself. But I had to learn how to rest. And I wish I knew that at the very upfront. If I had took that to myself, I think I would have done a lot better in the process. But all in all, it went very well.
Thank you both. We have Kimberly that has joined us. So thank you, Kimberly. Both Barbara and Gloria have just introduced themselves and shared their cancer experience. And we were wondering if you would be willing to do that as well. And then we'll get back to our discussion.
Hello, everyone. Sorry I'm late. My name is Kimberly Delost. I am 37 years old. Last year I had a miscarriage, but along with that, I got the pap smear and then found out that there are abnormal cells, which are tested. When I found out I was pregnant again, a couple months later, a couple weeks after that, we found out that we had some abnormal cells which were tested again, and then we were told that it was carcinoma of the cervix, or in the cervix. So the cells were kind of popping up everywhere. And I worked with Dr. Roque and his team, along with the maternal feed team. And through a couple cone biopsies, and then through a successful hysterectomy, a full hysterectomy at the end, along with a C-section, we were able to, as of now, get rid of all signs and have clear margins, and successfully also carry and bring in my second son into the world.
Thank you, Kimberly, for sharing such an experience that you've gone through within this last year. From a healthcare provider standpoint, is there something that we as healthcare providers could do more for you guys, especially in the beginning? I know it's very overwhelming. And is there something that could maybe just ease the transition?
Sure. I definitely feel maybe reading into the personalities of people more. For me, I had a great experience, and actually I was terrified of losing the baby at some point along the way, as well as the cancer itself. And Dr. OK, after the robotic arm surgery, I had to check my lymph nodes. I was in a lot of pain and I was terrified. And he called me the day before Thanksgiving, and he was on, PTO, and called me to let me know that the results came in right away, and all my pain went away, and because everything was good. So I think with that kind of just reaching out, when results are coming in, or being on top of things, even on time off, which is not necessary but always appreciated, just showed an immense amount of care. And I think that kind of determination alone from the teams there is very helpful.
Barbara or Gloria, do you guys have any additional comments on that question?
Not more that I think you could have done, but I do want to comment on what was done when I had also had the total hysterectomy, and the morning after my surgery, Dr. Roque and my hospital room door open. Here was Dr. Roque and the entire surgical team. And immediately when I saw him, my thought was, there's something wrong. But they came in, they said, to celebrate their superhero. They don't know what that did to me, because I'm a cardiac patient. I have pulmonology problems. I just got all kind of things. But they came in to encourage me. And I'm like you. Everything just went, there was no more cares. I knew that this team of people really cared about me. So I just want to say, Northwestern, your team does an outstanding job. That just overwhelmed me.
As far as my input for my healthcare team, the most important thing they did for me, especially Diane Egley, my PA, is my hero. She knows me so well, knows that I'm always thinking, 12 steps ahead, and knows that I need to see the information before I could deal with the information. So as far as getting scans and that, I think knowing your patient, knowing how they want to receive information, need to receive information, is of the utmost importance. Because if I needed to wait for my visit to get my scan reports every time, no one was going to be happy. So Diane knew me well enough that all my stuff was just released, so I can come in and with informed questions. Blindsiding me is never a good thing. So I appreciated her knowing who I am and how I needed to communicate. So communication is the key to everything.
Yes, absolutely. Thank you all for the suggestions. And I know as healthcare providers, we're always trying to improve ourselves to make things a little less easier on you. We know things are not easy at all, but at least give you some type of relief that you do have a good care team that cares a lot about you, and that is maybe a couple of steps ahead, or even more, 12 steps like Diane, who's absolutely wonderful at CDH. So that's great. And let me see if there's any questions. I think there's really just some comments. Thank you, Patty. That's very nice of you. Is there any resources that you guys believe that haven't been beneficial to you or haven't been thought of yet throughout your experience?
I can't think of any.
Not really. I mean, in the beginning, as an oncology nurse, I did not seek out, any additional resources. I had my medical team. I had my my previous doctors. I think I had it pretty good with as far as my knowledge base and my access to very good brains that I could pick. So I feel blessed to have been an oncology nurse going through this. Honestly, I don't know how people without medical background navigate everything. I give you so much credit because there is a lot of information to absorb, and it's just beyond overwhelming. So I salute you all.
Kimberly, you had your hands raised. You have something to say?
Oh, I was going to say, in terms of the journey, specifically with my experience, I was pregnant and the cancer was where the cervix was. So I was just terrified and on all accounts. And I really reached out to a lot of people that I had known had gone through cancer, but not specifically with that. And a lot of people kind of putting me in the same directions, but they weren't helpful. And then someone actually recommended the Facebook groups. And through the Facebook groups, I found a ton of women experiencing or had experienced different types of cancer, gynecological cancer with pregnancies, which was both comforting and scary to hear the stories. I also found a network called Pregnant with Cancer, which was a big network of women who had sponsors. And I found someone who also had cervical cancer who was pregnant and did carry full term. So it was really nice to have that person to go through the entire experience with, who had done it before, and kind of gave me hope for my own situation.
Thank you. That's great. Let me see.
Nicole, really quickly, I'm just
Yeah.
having humor because I love the fact you know me well enough. Nicole and the team, we have like a sense of humor. You may or may not see, but that big frame, the black and white of the survivors, and when you walk on the 4th floor, when you're coming in, I think some of the at downtown, I always say, when is my picture going to go up? Because I really like all those, you know, I'm like, it's huge. I'll take a smaller version. It's okay. But thank you, Nicole. It's just, you know me, just my sense of humor of how you guys have been always, that's the way I handled cancer, as you know, because I would never say the word, was through humor. But, and Nicole, you were always there to always make sure that Dr. Tanner caught what I was saying. Like, what? What did she just say? What do you mean that's a slip? And there was Nicole with her team. Thank you, Nicole.
You're welcome, Patty. Thank you for sharing. And you know, we would love for all of our patients to be up on that hall. I think it's really uplifting, and it's nice to see everyone's faces. And the diversity of, you know, the possibility of having a GYN oncology cancer as well.
Mhm.
We do have another question. This might be for Barb. How do you not let ovarian cancer statistics not get you down?
Now is a good time to have cancer. Not that any time is a good time, but the science is evolving. I'm participating in a clinical trial, which I'm pretty sure is not working. My next scan will tell the tale. But I've seen cancer in general being treated as a chronic disease for years. Lung cancer patients, you know, living, you know, 10 years where, you know, once upon a time, you were lucky to live out the year. I'm hoping that more research goes into ovarian cancer. I've been doing a lot of fundraising, trying to be more active in the community in general. But I can't worry about things I can't control, is basically what it comes down to. I can't control the fact that I have stage 4 cancer. What I control is how I deal with it by collecting my options. And that's where my conversation with Diane came in. It's like, okay, I have my suspicion. What are my next options? So I have time to mull those over. So I can wrap my head around things. So, you know, I've got this covered. It's only cancer. There are worse things.
Thank you, Barb, for just being so raw. And I think that's what this panel is for.
Right.
Because GYN oncology is different than a lot of other cancers. And, you know, when you go into these chat groups, a lot of other people don't understand. So it's great to have you 3 women just sharing your experience and giving, you know, the realness of it all, and not that it's always, you know, butterflies and rainbows, and that it really is hard. It's hard. So thank you for sharing. I don't see any other questions, but I do have a question. What does survivorship mean to all 3 of you, if you don't mind sharing?
For me, Nicole, survivorship means another opportunity for me to encourage someone else that's going through it, because I've been through it. I know what it feels like emotionally, physically. So I'm just grateful because that surviving it has given me an opportunity to help someone else.
For me, it has been truly an eye-opening experience, just finding joy in everything, every day, seizing the moments that you can, trying to spread the word, and just living the best life that I can. That's my only option. So looking forward with realistic views, but hope as well.
I think for me, it kind of opened my eyes to appreciating every moment, especially now with my boys, and just life itself. As you know, we're making trips now, and my husband was stressed out, and so and with me going through this, we were expecting each other to carry the weight of each other instead of just talking about it. So learning how to appreciate the time we have together, and appreciate just kind of everything. I think that's the biggest, and it's sad that it had to be that, but it really opened my eyes to my present world, and how thankful I am to have it, and how enjoyable it really is if I just let it be.
Thank you, guys. And so we're kind of getting towards the end, but I wanted to see if there was any other questions. If someone doesn't want to write in the chat box, you're more than welcome to verbally ask your question. And then if there are no questions, if there's anything that the three of you want to just share that you haven't shared thus far, and if not, totally understandable, because you've shared a lot and we are absolutely grateful and appreciative.
One thing I found very helpful when I was first diagnosed, of course, my mind's racing, thinking about how other cancer patients I had treated had felt and been treated. So I wrote up a manifesto about just laying down what was going on with me, how I was choosing to communicate, kind of the rules of engagement. And that was really empowering for me, just to, just have it in black and white. This is what I have. This is the way it is. If you want to deal with it on my kind of dark and twisty terms, then call, text, whatever. But just know that I just wanted people to know that I was the same person, that my dark humor was not gone, that I was gonna joke about cancer, and that was my coping mechanism. So I guess that was the only really thing I wanted to share.
Thank you, Barb. There is a question for you. How did you get into a clinical trial? Do you mind just giving a little insight on that?
It was offered. I met the criteria. The goal of the clinical trial was to see if we can extend the time to progression. So I weighed the options of just doing the traditional chemotherapy, carbotaxol Avastin, versus adding on the potential of getting a immunotherapy along with a PARP inhibitor. And I talked extensively with the doctor that I previously had worked very closely with, got his informed opinion, read all the stuff myself, and decided that I'd rather participate even if it was not beneficial to myself, that I was doing my part for science to extend the knowledge of what works, what doesn't work. So yeah, it was offered to me. So that's how I got in.
Thank you. If Gloria or Kimberly, if you guys have anything additional things to say, and I also have some more questions.
For me, Nicole, I just want to thank the team there. And another thing I learned in going through this program, I really trusted the team of doctors that I had. I had to learn to trust them. That's what kept my attitude up and really helped me. I trusted that I had been given people at Northwestern that really cared about me. They showed that they did. And I knew that they were going to do everything in their power to help me to meet the goal that I had set, which was to be cancer free. But also I made it a point to try to keep them encouraged when I came into the office. I tried to keep my medical team encouraged also, because I realized that even though this is you all's job, Barb, Nicole, this is the job that you do, it's your career. But nevertheless, I know that when we get cancer, it has an effect on you guys also. So I always try to keep the medical teams and the caregivers encouraged. And thank you for everything.
Thank you, Gloria. That's very sweet of you. Kimberly?
For me, I would say advocate for yourself. You don't realize what that means until you're in a situation where you're making choices, or you realize that you can have choices for yourself. Educate yourself on all the information that's given to you. Write down questions and conversate with your doctors and nurses as much as you want, and don't feel bad or guilty or worried. If you have questions, it's your life, it's your body. And also in doing the research, I think like Barb said, don't focus too much on statistics, because statistics are just numbers. And you really just need to focus on who you are and what you're going through at the moment that's happening. Because there's a lot of statistics on, getting in car accidents, and you might not get in one. So same things with cancer. You can't focus on those numbers. Those numbers are other people. You just have to focus on yourself.
Thank you, Kimberly. So I have two more questions, and I think they will be helpful for your care team. So I do want to ask them to you. So from Dr. Towner, she has a great question, and she always thinks of ways that she can be a better communicator with patients. And have you had any negative interactions with anyone or the medical team? And can you talk a bit about it, and how could they have done it better? And if I could just have one of you answer that, that would be wonderful.
I can answer that. Sometimes it is difficult being heard, even as a nurse. I was having issues related to the immunotherapy, which I'm still blinded, but I know what I was on. So, but the doctor who I was seeing, my oncologist, dismissed my complaints, saying that, oh, that only happens to 1% of the people. It's like, yeah, but it happens to someone. So I don't appreciate being dismissed. And I think just listening to your patients, knowing them, knowing that I was not an alarmist in any way, that I had been dealing with issues for a long time, and still was not heard by my primary oncologist. That was a rough time, a rough moment for me. but I've moved on, and I'm going to be seeing a new doctor within the practice soon. So, you know, I got over it. I got steered in the right direction, but I certainly did not appreciate being dismissed. So,
Barbara, thank you for sharing that. I know it was hard, but this is the information that we want to know and need to know in order to provide better care for you, but also the rest of our patients. So thank you for that. The last question I have is from our infusion nurse team, and they would like to know if there's any tips for the chemo infusion nurses that you feel would be helpful while we are with you during your infusions. And if anyone that's received chemotherapy, if one person could respond to that, that would be grateful.
I was certainly on chemo, and as a chemo nurse myself receiving chemo, it was a little different being on the other side of the chair. But my advice would be to, again, know your patients. If there's the opportunity to, follow the same patient, or at least, read the notes from the previous nurse and see if you can get a handle on where that, patient's coming from, and take that to heart. I was blessed to have the same nurse through most of my treatments. And once I was on maintenance, I started getting kind of shuffled around a little bit, and truly appreciated the nurses who would look to see what had been going on versus the ones that would come in blind, apparently not knowing who I was or where I was coming from. So that would be my one tip.
I think that one tip is a great tip. I will say, as a nurse and a nurse practitioner, and in oncology for my entire career thus far, I will say, just looking at a patient's chart gets you a long way, and just like those few my chart messages or that last office visit will really provide you so much information about that patient, and anything that you're questionable about, you can clearly just ask them, right? You're right there in front of them. And they are entrusting their life in your hands as a provider. So yeah, communication is key. I do always say that. So thank you. I see one more. Mostly these are all just comments in here. And so thank you everyone that's commenting to the team. We appreciate that, but just thank you so much to the three of you. So unfortunately, that's all the time we have for our panelists, but we want to thank them again for allowing us to hear their stories and their advice. We have another break before our next breakout session at 12. So please turn off your microphones as well as your cameras during the break. If you have any time, please take a moment to visit our virtual exhibit hall. Thank you.
Thank you.
Thank you, Gloria, Kimberly, and Barbara. I greatly appreciate chatting with you guys this morning.
Thanks for having us.